Hello, and welcome to our panel discussion on erythropoietic protoporphyria, EPP, phototoxic, light-triggered reactions, and systemic complications associated with accumulation of PP9. This video program is sponsored by Disc Medicine. The speakers are not employees of Disc Medicine, but have been retained to present on Disc Medicine's behalf. Today's speakers are Dr. Bruce Wang and Dr. Gail Ross. I'll let each of today's speakers introduce themselves. And Dr. Wang, let's start with you.
Hi, Josh. I'm Bruce Wang. I'm a hepatologist and associate professor of medicine at the University of California, San Francisco, with a focus on inherited liver diseases. I run the UCSF Porphyria Center, which is the main referral center for patients with porphyria on the West Coast of the United States, and I run a research laboratory studying basic liver biology. I'm an active member of the NIH-sponsored Porphyrias Consortium, and I'm also a member of the American Porphyrias Expert Collaborative, serving on its board of directors. I have been a principal investigator on several clinical trials in porphyria, including the Aurora trial.
And I'm Gail Ross. I'm a dermatologist and an associate professor of dermatology at the University of Melbourne in Melbourne, Australia. I specialise in porphyria and I run the Porphyria Expert Centre at Royal Melbourne Hospital, which is the main referral centre for porphyrias in Australia. I've been an active investigator in multiple porphyria trials over the years, including the Beacon trial, and have published widely in this area.
Doctors, a pleasure to have you both with us. Thank you for joining us, and we're looking forward to learning more about the cause and impact of this rare disease, as well as hearing more about your experiences with EPP. Now, we should note that this video program is split into 3 video chapters. Chapter 1, Illuminating PP9, the cause of phototoxicity and systemic complications in EPP XLP. Chapter 2, Understanding patient health and psychosocial burdens of EPP. And Chapter 3, Advancing care for patients with EPP. Now, in Chapter 1 of this series, Illuminating PP9, the cause of phototoxicity and systemic complications in EPP XLP, Dr. Wang and Dr. Ross will establish the understanding of EPP as a severe chronic systemic disease caused by accumulation of PP9, a toxic metabolite of abnormal heme biosynthesis. It's now my pleasure to turn this presentation over to Dr. Ross, who will begin with an overview of EPP. Dr. Ross?
Thank you. So erythropoietic protoporphyria, or EPP, is a rare, debilitating, lifelong disease which impacts males and females equally. It's estimated to occur somewhere between 1 in 50 to 1 in 200,000 individuals worldwide. The age of onset varies, but it's in childhood. Most children will experience photosensitive symptoms in the first year of life, but diagnosis averages around the age of 4.
Dr. Wang, can you tell us a little about the cause and characteristics?
Sure. In terms of clinical characteristics, EPP generally presents with skin phototoxicity. Most commonly, this is acute pain on the parts of the skin that are exposed to direct sunlight. But it can also present with potential liver complications, which can progress to liver failure. The cause of EPP is due to loss of function variants in the ferrochelatase gene. A second, less common cause is due to gain of function variants in the LAS2 gene that results in the X-linked protoporphyria, or XLP. But it's important to know that variants in either one of these genes present with the same clinical manifestations of skin phototoxicity.
In this diagram, we can see when ferrochelatase, or FETCH, and ALAS2, these are our 2 critical enzymes involved in the heme biosynthesis pathway. When one of these enzymes is altered, the pathway is affected, and this is occurring in the red blood cells in the bone marrow. So defects in FETCH or ALAS2 result in accumulation of PP9. This PP9 is released from the bone marrow into the bloodstream, and when light hits this PP9 molecule, it's highly photoreactive, which means it'll emit energy when exposed to the visible light, causing cellular injury and inflammation. And this causes the characteristic photosensitivity that patients with EPP will experience. So PP9 accumulates in the liver, in the skin, and in the vascular system, and this is what results in our symptoms.
Dr. Wang, could you walk us through the prolonged diagnostic odyssey that patients and caregivers often navigate?
Sure. Because most often EPP presents in childhood. Following the onset of symptoms, the patients or their caregivers generally start by visiting the pediatrician. Now, unfortunately, because the disease is quite rare, porphyria oftentimes is not thought of on the initial differential diagnosis. And often the patients cycle through a number of other physicians before the diagnosis is made. Most commonly, patients end up seeing dermatologists and allergists as the subspecialist that will eventually see the patients and make the diagnosis of EPP. Some physical signs of repeated phototoxic reactions, such as scarring and skin thickening, which results in a leathery appearance on the knuckles and face, those are oftentimes what finally leads to the diagnosis of EPP. However, there could be a very long delay. So in the United States, the average time to receiving a diagnosis of EPP after developing initial symptoms is 13 years.
And what type of testing is required to provide an official diagnosis?
So the primary diagnostic test for EPP is total erythrocyte protoporphyrin concentrations. There are two types of protoporphyrins that can be measured. There's metal-free and zinc-bound erythrocyte protoporphyrin fractions. Now, EPP is indicated when there are substantially elevated erythrocyte protoporphyrin levels, generally greater than 3 times the upper limit of normal. And the majority of the elevated protoporphyrin is metal-free. There are 2 methods that can do this. One is high-performance liquid chromatography. Second are extraction methods, and these can measure the total, the metal-free, and the zinc protoporphyrins, and that's what's recommended for the diagnosis of protoporphyria. At present, in the United States, only the University of Texas Medical Branch Porphyria Lab and the Mayo Medical Laboratories are recommended for these tests by the United Porphyrias Association and the American Porphyria Foundation, 2 patient advocacy groups for porphyria in the United States.
And what are the recommended testing levels for plasma porphyrins?
So that test is actually not recommended for diagnosing EPP, as the levels of plasma porphyrins can be normal or only mildly increased in patients with EPP. There are several other tests that are associated with other porphyrias that are also not recommended for making the diagnosis of EPP. These include urinary porphyrins and fecal porphyrins. Both generally remain normal in patients with EPP. Also, a skin biopsy is not recommended to make the diagnosis of EPP and is generally reserved to rule out other potential causes of similar kinds of phototoxicity.
Is genetic testing recommended?
So if a diagnosis is made based on significantly elevated PP9 levels, then genetic testing is recommended to distinguish between EPP and XLP.
Dr. Wang, thank you for sharing those insights. I'd now like to pass the presentation back over to Dr. Ross. Doctor?
So accumulation of toxic levels of PP9 is the underlying cause of EPP, leading to damage in the skin and other organs. So the phototoxic reaction in the skin is the most well-known clinical manifestation of EPP, which consists of severe burning pain and will sometimes lead to mild erythema and edema in the skin. We also see PP9 accumulation in the bile canaliculi, and this is what can cause liver damage, including gallstones, liver dysfunction, and occasionally liver failure. We also see osteoporosis in these patients. So their severe photosensitivity means they avoid the sun and they often become vitamin D deficient. They're often also anemic and can complain of tiredness. So as a result, many patients will receive concomitant medications. About a third are taking antidepressants. Roughly a third will be treated with narcotics due to the severe pain involved. And around 20% will receive prescriptions for vitamin D. It's important to note the cumulative damage we've outlined here can precipitate a variety of psychosocial effects on the individual. It's not uncommon for these patients to experience depression and anxiety, feelings of isolation and loneliness due to the difficulties they have leading a normal life. The severity of the phototoxicity amongst patients with EPP or XLP is often associated with their PP9 levels. So it can vary from patient to patient how much time it will take in the sun before they'll first start to experience symptoms. This can range from a few minutes up to some hours. As far as what a phototoxic reaction feels and looks like, it's usually pain, as we've mentioned, and this is a severe burning pain which lasts for days and is unrelieved by conventional analgesics. In severe cases, it may be accompanied by visible signs such as edema, erythema, or purpura, but in most cases, we don't see anything, and this is what it's often so difficult to make the diagnosis. We can see here in the graph on the right, there's a study of 226 patients with EPP or XLP looking at the relationship between PP9 levels and the time for the patient to experience their first phototoxic symptom. It found that the patients with the more severe phototoxicity had higher median PP9 levels compared to those reporting symptoms after more than 10 minutes of sun. It's also important to note that even direct sunlight avoidance does not prevent PP9 accumulation. So the PP9 is sitting there in their skin, in their vessels all the time, and obviously it's in their liver, which is why there's this underlying risk of liver disease unrelated to the sun exposure. So as we've mentioned, osteoporosis in these patients is due to vitamin D deficiency from inadequate sun, and around a third are iron deficient or mildly anemic, and we don't fully understand the reasons for this.
Dr. Ross, thank you. And that brings us to our next topic in this series, and that is the relationship between PP9 levels and liver dysfunction in EPP. And for that, we turn things over to Dr. Wang. Doctor?
So in EPP and XLP, liver dysfunction is also associated with higher PP9 levels. This has been seen in prior studies and has recently been validated by a newer study. So the graph that you see here is based on the latest longitudinal natural history study done in the United States, and includes the largest cohort of patients with EPP and XLP, with 322 patients. And what you can see here is that the liver biochemical test, AST and ALT, are higher when associated with higher levels of PP9. And this confirms previous findings as well, that higher PP9 levels are more commonly associated with liver enzyme abnormalities. Now, based on the same natural history study, we can see that systemic hepatic and biliary complications can be seen in a subset of patients with EPP. A little more than half of the patients with EPP and XLP have elevated liver biochemistries. 3.4% had protoporphyric hepatopathy, and 2.5% of these patients required liver transplantation. 62.5% of the deaths that occurred in this cohort were attributable to liver disease. Many patients with EPP also develop cholelithiasis, or gallstones. In a different study, gallstones were found in 22% of patients with EPP, 40% of male patients with XLP, and a third of female patients with XLP. Cholecystectomies were performed for 39 of 45 patients with EPP with gallstones, and for all patients with XLP with gallstones.
So are there any other comorbidities or complications with EPP that are important to note?
Yes, I'll turn this over to Dr. Ross, who will cover some of these complications next.
Thank you. The first thing we'd like to emphasize is that patients with protoporphyria are at an increased risk of anemia. The prevalence of mild microcytic anemia is estimated to be anywhere between 20 and 60% in the EPP population. Individuals with EPP are also known to have iron deficiency. However, there's abnormal iron metabolism as well. So we don't fully understand this. So as a result, the microcytic anemia, low iron and ferritin levels in patients with EPP is currently unknown and under investigation. Vitamin D deficiency is also fairly common, found in approximately half of all patients with EPP due to sun avoidance. But this can ultimately result in poor bone health, with around 23% of patients experiencing osteoporosis, and this can obviously lead to fractures.
So regarding negative psychosocial impacts, we'll go into the details a bit more in the next chapter, but I do want to point out that Psychosocial impacts are a common element associated with EPP. These can include negative effects on mental health for individuals of all ages, primarily associated to the isolation that can come from avoidance of sunlight. There are limitations on daily activities. There's time loss in social situations and environments. For example, patients may not be able to attend a social event because of the location, on the beach, a picnic in the sun, or they might need to leave early to avoid the sun. And lastly, patient frustration due to the lack of understanding from other individuals.
Dr. Wang, thank you. And that brings us to the conclusion of this first chapter. But let's take a minute to review some of the key takeaways first. Dr. Ross, let's begin with you.
EPP and XLP are debilitating rare diseases characterized by painful phototoxic reactions that are often challenging to diagnose in early childhood.
EPP and XLP are caused by variations in the PPIX and ALAS2 genes, respectively, leading to defects in heme biosynthesis.
Defects in PPIX or ALAS2 result in the accumulation of toxic metabolite protoporphyrin IX, PP9, in bone marrow.
In addition to skin phototoxicity, accumulation of PP9 may result in multi-system damage that includes hepatotoxicity and bone marrow comorbidities.
Negative psychosocial impacts are common in patients with EPP.
And with that, we conclude Chapter 1 of our video series. Thank you for watching Illuminating PP9, the cause of phototoxicity and systemic complications in EPP XLP. Very special thanks to our presenters, Dr. Bruce Wang and Dr. Gail Ross, and thanks to you for tuning in. We'd also like to thank Disc Medicine for their sponsorship of this session, and we certainly hope you can join us for the next video in this series on EPP.